Participation hearing. We'll take, roll has already been taken, so we'll consider that from the meeting before. The Price County Health and Human Services Board will hold an annual public participation meeting to encourage public comment and discussion regarding the scope of services to be provided for 2026. The meeting is open to public pursuant to Wisconsin Statutes Chapter 13, Subchapter 5V, Open Meeting Law. Public members may access all public meetings via conference call or WebEx online. So we're calling the meeting to order. I will accept public comments regarding planning and budgeting for the following. We have department heads Dawn Griesel and Chris Mabey here to hear them. Aging and Disability Senior Services. Services include but are not limited to information and assistance, long-term care options counseling, functional and financial eligibility for publicly funded long-term care programs, elder and adult at-risk abuse investigations for 2025 through 2027. Aging plan for the elderly, congregate and home delivered meals, transportation, elderly benefits specialist program, National Family Caregiver Program, Alzheimer's Family Caregiver Program, disease prevention and health promotion program, dementia care specialist, disability benefits specialists, and others. I see and hear none here at this time. I'll move on to the next one.
This is the only public comment period.
Yes, this would, I'm going to say them all, so you could talk to one of them, or did you want to speak to the aging and disability senior citizens? No, so okay, so would you like me, I'll just read them all through till the end and just before we adjourn, if you have something to say about one of them, or if I will stop after each one, Clint.
I just like to start the whole works in general.
What's your pleasure? Do you want me to read them all, or do you want me to have him speak first?
This would be my only chance to speak, correct?
Yes.
Want to wait till the end? Yeah, why don't you just read it?
I'm going to read them in that way. Okay, so we'll go to number 2, where Chana Markowitz is the department head. Excuse me, Behavioral Health Division. Services include but are not limited to in-home supports, mental health and substance abuse. Excuse me a minute. Disability services for children and the Birth to 3 program. Number 3, Kayla Borgen is the department head here, Children and Youth Division. Programs include but are not limited to Children and Family Services, Child Protective Services, and Juvenile Justice. Number 4, it would be Sarah Soha, or the department head, Economic Support Divisions. Services include but are not limited to Food Share and Food Share Employment and Training, Badger Care and related insurance programs, Wisconsin Home Energy Assistance Program, and General Assistance. Number 5, again, it's you as well, right? Oh, this is Tiffany. This would be Public Health Divisions. See, I should have eaten my cake first. Services include but are not limited to communicable disease, maternal child health, public health nursing, environmental health, family planning, WIC, which is women, infants, and children, and any other services developed. Number 6, available to the public through the Health and Human Services Department. Now, Clink, you know that we cannot respond to you. You're just going to make a comment, and the departments will take it back and get back to you if there's anything, okay? All right, so if we can have you come up to the microphone. Okay, he's just going to turn it on for you and get it there. I'll have you state your name and where you live. Your
Got the
town.
bar stool option, might as well use it.
I love that.
Hi, I'm Glenn Schilling Electric since 1989 or 83. And I live at N991 Dardis Lake Lane in Phillips, Wisconsin. I'd just like to state, I don't get much out of your program. I don't want much out of your program. I don't know if I'm even eligible for anything on your programs. And I'd like to see more responsibility on the people that are using your programs. Like time limits, work requirements, GED requirements, or strive to get GEDs if they're on the programs. Financial responsibility, using coupons on purchases for food and things like that. Maybe give them some financial services classes, no smoking or alcohol while they're on your programs, and maybe a healthy weight if they're receiving, strive to get down to a healthy body weight. And try to help people get people off these programs, not on. I guess that's all I want to say. And hopefully I can get a little help. I could use a little help. I got all kinds of work for people. I got calls. No, I just got one when I got here. There's all kinds of work to do in society. There's no sense. In the old days before all these programs started, my grandparents, we were out at Emory out there. There was nobody on this stuff, and they worked hard. And friends help friends, and neighbors help neighbors, and we got along, and got things done. Well, Jan Hemmel, Rudy, and Helen Piala and stuff. I guess that's all I want to say. Thank you for your time.
Thank you, Klink.
Good day.
You too. Turn myself off. And with that, we are adjourned. Thank you for being here, everyone. Have a good evening.
That whole damn thing was just for me to give a spiel like that. Holy Christ.
That was a good way to end it.